Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I'm your host. Always excited to be here. And today we're doing a learning episode, and very excited to do this learning episode because one of my most favorite things to do is teach. And I realized on the podcast, I want to do a little bit more teaching. So today we're going to be talking about dentinal hypersensitivity. And I'm also very excited because this episode is sponsored by Curaprox. And we're going to be talking about some of their amazing products today, specifically their Curaprox Hydrosonic Pro. And the reason why I want to talk about this specifically is because it can help patients with hypersensitivity. Okay, so let's just dive right in, get into the knowledge. What do you need to know? You are going to have patients with hypersensitivity. I can guarantee it, whether it's your first day in clinic or your second day, you're probably going to experience some hypersensitivity. So what actually is that? Dentinal hypersensitivity is referring to basically a sensitivity to a stimuli of some sort. So you're in there, you're scaling the teeth, all of a sudden your patient goes, ooh, and gives you like a really quick kind of jolt, and you're like, whoa, what happened? And they're like, I don't know. I just got this kind of sharp, like almost like a lightning strike or just this very sensitive moment, right? It's going to happen. And so when it does, we need to know what to do about it. Now, I want to share a little personal story. I had a patient who came in specifically because of their dentinal hypersensitivity. I knew I was not going to be able to scale it in that moment. I knew, they couldn't even brush it with a toothbrush. That's how sensitive it was. So we have to have in our toolkit basically recommendations for how to manage that. And let's really get into all of those recommendations. But again, first we kind of got to know what it is. Okay. So dentinal hypersensitivity is a pain elicited by a stimulus, and it will go away with removal of the stimulus. So what does that mean? It's a sharp jolt. It's not going to last for minutes. It's not going to linger. So that can be kind of helpful in determining different types, like what is causing the pain. Is it hypersensitivity? Is it caries? I'm not saying that this is a perfect system all of the time, but it can be helpful. If the pain's not lingering and it goes away once the stimulus is removed, then there's a chance that that is dentinal hypersensitivity. Some of the stimuli that can trigger the sensitivity would be tactile. Tactile means touch. So if you touch it with a toothbrush, if you touch it with a utensil when you're eating, or if you as a hygienist touches it with an instrument, that may stimulate that sensation. Thermal, which is temperature, is another thing as well. Cold fluids are actually pretty much the most common stimulus. Your patients may even say, oh yeah, I don't eat really cold stuff, or I don't even drink cold water anymore. I no longer drink ice water because it's sensitive. Okay. Hot can also do it as well, but just keep in mind, cold is usually the most common stimulus for pain. Evaporative. So if you're in there and you have the suction right next to that tooth and it's pulling the moisture away from that tooth, that can actually trigger sensitivity as well. And we also have chemical. Okay. So chemical can be acids from foods, citrus fruits, certain condiments, really sugary foods as well can trigger that as well. So we just have to keep in mind there are a lot of different stimuli, and it's a good idea to ask your patient, what triggers it? When do you notice it the most? Okay. And from there, we can kind of start coming up with some ideas for how to help them. All right. So let's just recap the main characteristics of dentinal hypersensitivity. You're going to have sharp, short pain. Okay. Rapid onset, meaning all of a sudden it comes on, feels like a lightning strike almost. Once you remove the stimulus, the pain goes away, and it has acute episodes, which means they come on and then they go away, right? Or they come on really quickly. Now, the last thing I want to mention is we do have to assess the entire tooth and make sure there's not something else going on. There could be decay, right? We have to make sure that there's not something like that going on. If you just say, oh, sounds like dentinal hypersensitivity, and you treat it as such, and then your doctor comes in and tells them, oh, actually, this is huge decay, that's going to kind of come off, wrong. And I actually had a situation happen like that once where I didn't see decay and I told the patient it sounded like dentinal hypersensitivity. I recommended fluoride. When the doctor came in, they actually kind of got on to me later and they were like, you shouldn't tell them what it is. And that's true. I cannot diagnose, and that is not my specialty. So keep that in mind. We can maybe think, okay, this is what I think it is, and start coming up with a plan in our minds. But oftentimes, depending on your scope of practice, the state you live in, you may have to confirm that with your doctor before you move forward with those. So the next thing, how come you have dentinal hypersensitivity? What happens? We have to remember a little bit about the way the tooth is designed. Okay, so picture in your head, you're smiling and you can see the crown of the teeth. What you're looking at is the enamel, right? The enamel is the hardest structure in the body. And what does it cover? It covers the underlying dentin, okay? And then underneath the dentin is the pulp, which is the life force of the tooth. That's where the blood vessels, the nerves, the things that keep the tooth alive are inside the pulp, right? So the pulp is at the very center of the tooth. In the root, we have the pulp. And then we have the dentin. So essentially the dentin is the bulky layer that protects the pulp. But one difference between the crown and the root of the tooth. Remember I said the crown, when you smile, what you're looking at is enamel, and that's covering the dentin and the pulp. But in the root, instead of having enamel covering the root surface, we have a different structure and it's called cementum. Okay. So cementum covers the root, and then underneath it is the dentin, and then inside is the pulp. All right. So with that being said, cementum is only about 50% mineralized. It's a very thin layer. That's different compared to the enamel. The enamel is 96% mineralized, and it's a pretty thick, bulky layer. So if we start to see gingival recession, meaning the gum is starting to move away from the crown, and now we can see some of the root exposed, what we're looking at is the cementum of the tooth. The cementum is not as thick and it's not as strong. So it's possible to lose cementum. And when we do, what is exposed? That dentin that lies underneath. The interesting thing about dentin is that it's filled with a bunch of tubules, okay? And these little tubules go from the edge of the dentin all the way to the inside of the pulp. And guess what runs in those little tubules? The tails of odontoblast. And you may be like, this is a lot of information, but we're going to take you a little bit into the world of embryology, histology right now, okay? An odontoblast builds dentin. Okay. And our odontoblast are present right at the edge of our pulp and our dentin for our entire lives. And they continue producing dentin slowly throughout our lives. This is why as we get older, our pulp gets smaller. It gets narrower and narrower because our odontoblasts are growing in towards the pulp and they're laying down new layers of dentin throughout our entire lives. Okay. The tail of the odontoblast, and if we think about the word odontoblast, blast means to build, dont means dentin, or odont means dentin. Okay, so it's building dentin. These odontoblasts have really long tails. And where is the tail? It's inside of the dentinal tubule. And wrapped all around it are basically the nerves from the pulp. Okay, so if we lose cementum, one of its primary purposes is to basically cement off those dentinal tubules, right? And prevent them from having exposure to the outside world. Because if they're exposed, that can lead to sensitivity. And that is what's known as the hydrodynamic theory. It's the most commonly accepted theory right now for what is actually creating this hypersensitivity reaction. So basically what they say is fluid movement creates pressure on the nerve endings that are inside of that dentinal tubule. And that transmits pain from the outside of the tooth to the inside of the tooth, the pulp, which is where the bulk of the nerves are, right? This is the best known reason for why we get dentinal hypersensitivity. But in order for it to occur, you have to have loss of cementum on the root, right? Or loss of enamel as well. If you lose the enamel, you're going to expose the dentin, right? And then you're going to have those dentinal tubules that are open. So how do we lose the coverings, right? How do we lose cementum and increase the risk for hypersensitivity? One of the big things is overscaling the patient. If we scale too much, we can actually remove that cementum, and now their dentin is exposed and they may have more hypersensitivity. Excessive brushing, using really abrasive toothpaste, right? Anything that is, really damaging to the cementum. So medium or hard bristle toothbrushes, we're always recommending soft bristle toothbrushes. A frequent long-term aggressive use of toothbrush or other oral hygiene devices. We can even see hypersensitivity occurring from erosion, which maybe if the patient is sucking lemons or limes a lot, if they have a really acidic diet, or if they have acid reflux, acid coming back up from their stomach into their mouth, that starts to erode away the hard tissues of the teeth and can expose the underlying dentinal tubules. Okay, so there's a lot of reasons why we may get hypersensitivity, but the most important thing is how are we going to manage it for our patients? Because I will say, if a patient is adjusting their life because of the hypersensitivity, that is a problem. If they're avoiding cold liquids, if they're nervous to get their teeth clean because their teeth are always really, really sensitive, then we need to start having a conversation of how are we going to manage that. Now, one thing that can help is hypersensitivity can naturally decrease a little bit over time. Sometimes we build more sclerotic dentin, we build excess secondary dentin, or even it could be covered by calculus. So think about it. You're going in to remove the calculus, and what happens? You take the jacket off of the tooth, and suddenly Now those dental tubules are exposed where they were covered up by a jacket of calculus for so long. This is why when you're explaining your cleaning to your patient, you have to explain to them, look at all this calculus. When I take it off, it's like taking the jacket off of the tooth. You're going to see parts of the tooth that you haven't seen in a long time. So the teeth will look different. Your teeth, it's like taking the jacket off. So your teeth may be cold or sensitive, and we can manage that if that's the case afterwards, right? So we have to be prepared for those conversations because that is a very common risk of basically removing that calculus. Things are going to look different and they may feel different as well. Okay, so when we get into how are we going to manage hypersensitivity, remember, you have to make sure that's what they actually have. So we don't want to just assume. We have to rule out caries. We have to rule out that the tooth is broken, some type of fracture maybe that you can't see on the x-ray. So we go through all that process and then we're like, okay, by process of elimination, we've decided that is dentinal hypersensitivity. Okay, this is how we manage it. There's really two ways: pain relief, and that's kind of what we're going to talk about, but also modification or elimination of the contributing factors. What is potentially making this worse? That could be a medium or hard bristled toothbrush, right? That could be dietary changes. Now, when it comes to pain control, there's really two modalities, and it's best to kind of link them together. One is using some type of toothpaste that will occlude the nerves, and then something that will also desensitize the nerves. Okay. So there's two different main ingredients, like potassium nitrate. That's a very common ingredient that depolarizes the nerve and prevents it from essentially repolarizing, firing off, and giving you that pain signal. Okay. So you usually have to use these for a couple of days to a couple of weeks to really get the process started. And then if you stop using that active ingredient of potassium nitrate, we usually see that the pain returns, right? So you're going to have to commit to kind of using something like that. The other thing is using some type of product that occludes the tubules, okay? Occluding the tubules means you're going to block those tubules off. It's almost like you're trying to kind of pack those tubules so that the little nerve endings inside of them aren't stimulated anymore, okay? Because remember, those tubules were initially covered with cementum. So now that the cementum is gone, it's like we want to replug those tubules. Some basic things that can plug those tubules would be like stannous fluoride toothpaste, which are really popular. They're over the counter. Also, your fluoride varnishes that you can apply in the clinic as well can help to occlude those tubules. Again, we want to use these things every day. So you might recommend a patient to use a desensitizing toothpaste in the morning with potassium nitrate, and then maybe a stannous fluoride toothpaste in the evening to help keep those tubules occluded. And then, of course, regular treatments with fluoride varnish, and you can use it just in that area too. If they have a really low caries risk, just put it just on that area if they really don't need it elsewhere. But again, if you're putting it on one area and you're opening the package, you might as well put it everywhere else. There are some other over-the-counter products which can be helpful. I'm not going to get into those too much today, but I just want you to be aware. Look for those two main ingredients, right? Potassium nitrate, stannous fluoride. Those are good things to recommend for your patients who have hypersensitivity. Remember what I said? Keep in mind it takes time for these products to work, but if they're in your chair, one of the first things you can do is paint that fluoride varnish on, and that really can help them in the moment. The other thing to remind your patients is that whitening products, especially, those high strength whiteners with a lot of carbamide peroxide, they do dehydrate the teeth, and that can increase dental hypersensitivity temporarily. Also, whitening toothpaste tend to be a little bit more abrasive, which may worsen the sensitivity as well. So have that conversation with your patient. Are you using whitening products at home? And walking them through the best ways to use that. If it's abrasive, maybe we're not using it on that area and we're being very gentle and you're teaching them how to brush properly. Make sure they're using a soft toothbrush, not a medium or a hard, right? Or if they're using whitening products, kind of walking them through that if they are experiencing sensitivity, they may not be able to whiten as frequently. Like they may, instead of whitening every day for 2 weeks, they may have to whiten, every other day or every 3 or 4 days. I'm like that. I cannot whiten day after day after day. They'll usually say that with a lot of those whitening products. I have to really space it out because otherwise my teeth get too sensitive. So keep in mind, what's happening. Think about the dietary modifications. What is triggering it? Is it sugar? Is it citrus? Is it really cold foods? Okay, let's try and bring those down a little bit, especially if they're damaging to the teeth, like sugar and citrus. But if it's something like cold water, okay, let's try and get the management of the issue underhand so that you don't have to avoid those foods and drinks anymore that maybe you used to. Ice cream is a big one. But again, ice cream is kind of a double-edged sword because we're like, I want you to be comfortable and eat what you want to eat, but also the sugar aspect as well, it's kind of a game, it's a balance. Everything in moderation. So one of the main things that I really want to talk about today is the toothbrush type and the technique that you're using whenever you're brushing, if a patient has dental hypersensitivity, and also thinking about to prevent dental hypersensitivity. Because remember, if you're brushing too hard, you could end up with recession that could lead to dental hypersensitivity. Same thing if you're using the wrong toothbrush, it's too aggressive, the bristles are too stiff, medium or hard. Those things can contribute to eventual hypersensitivity. So we want to make those recommendations to all of our patients, make sure that they're choosing the right toothbrush to begin with to help prevent those issues before they occur. If a patient has actual dental hypersensitivity, it's recommended to brush 1 or 2 teeth at a time with a soft or an ultra soft toothbrush, okay? You don't want them to use really long horizontal scrubbing strokes because that can lead to recession and more sensitivity, okay? So you don't want them to be brushing really aggressively. You don't want them to be putting a lot of pressure, right? Very gentle. When you're in school, you'll learn about the toothbrushing techniques, but you just want to make sure that you're recommending the best technique for your patient, okay? This is the opportunity to really have your patient show you how are they brushing? Where do they start? If they're using an abrasive toothpaste and a medium or hard toothbrush, bristled toothbrush, and they start in the upper right every single time and they just go to town, guess what area is probably going to have more sensitivity? That area. Guess what area is going to have probably more recession? That area. So what do we recommend? I recommend once they put their toothbrush in their mouth, spread the toothpaste all over. Don't concentrate it in one area and start in that area every single time, because that's just a surefire way to probably end up with some recession and some sensitivity. Okay, so spread the toothpaste all over. From there, I recommend starting in a different place every time. And if you see how they brush, or maybe if you do a plaque sport and you see that they have a lot of plaque, and maybe a hard to reach area, maybe encourage them to start in those areas, like the linguals, because we know people are going to finish up with the buccals because that's what they see, right? And the buccal is the surface that people are looking at, right? So we know people are going to brush those areas better anyways, just because it's, the lingual, which is the tongue side, out of sight, out of mind, right? Most people don't even realize they're not getting those areas good enough. So have them start in a different place every time, and that can actually help as well. Watch their grip. How hard are they holding on to the toothbrush and how much pressure are they applying? Because again, most of the time, I know this sounds sad because this is our job. Oftentimes we really don't get taught how to brush. I did not know how to properly brush, floss, take care of my teeth until I went to dental hygiene school. And I had been going to the dental hygienist getting my teeth clean, every year since I was, I don't know, probably 6 or so. So keep that in mind that someone may have actually never taught them. That is our job. That's what we're supposed to be doing. But oral hygiene education usually goes by the wayside. Usually they'll just say something like, make sure you're brushing every day, 2 times a day, right? But if you don't take the time to actually show someone and evaluate them, we really can't expect them to get better. Remember, what gets measured gets improved, right? Or I always say, what gets measured gets better. So if we take stock, we watch them, we can give them tips and tricks, then we can actually improve the pain that they're having in their mouth and improve their overall oral health as well, just by making small adjustments. Now, at this point in the conversation, I would really explore their willingness to try an electric toothbrush, okay? Now, the beauty of the electric toothbrush, and I want to make sure that I say this right, it removes biofilm effectively with less than half the pressure of a manual toothbrush. So first off, if you're using the wrong manual toothbrush and you're using the wrong method and you've never been taught how to do it, you're probably going to be doing quite a bit of damage, right? And so if we can get them to even just brush better with a better manual toothbrush and a better technique, we're already going to see improvements. But if we can get them to commit to utilizing an electric toothbrush, we're going to see even better benefits because, like I said, it removes biofilm effectively with less than half the pressure of the manual toothbrush. And that's a great thing because half of the problem is just brushing too roughly, right? The other nice thing is that some power toothbrushes actually have some type of sensor that helps you to be aware when you're brushing too hard, which is really nice. Now, one thing I mentioned probably 100 times already in this episode is that you have to choose a toothbrush that has bristles that are soft or ultra soft. And at the same time, you want it to be effective, right? So we have to make sure that we're choosing and recommending products that are going to be that for our patients. Oftentimes your patients don't really know what's the difference between this toothbrush, right? And they just walk down the aisle and they grab something. Or your patients may think harder must be better, right? While we know that that's not the case. And if we don't take the moment to educate them, then they really will never know, okay? So I'm really excited today to talk about the Curaprox Hydrosonic Pro toothbrush. One thing that's really interesting, a 2024 study compared Curin filaments, those are the special filaments that are on all the Curaprox toothbrushes. They compared these to traditional nylon bristles. And what did they find? They found that these bristles cause significantly less abrasion to enamel. And at the same time, they're still cleaning effectively. So how are they doing this? It's because they have polyester filaments, which I think are so interesting because they absorb very little water. So they maintain their shape longer and they stay really soft longer. If you ask your patient who who brushes really hard to bring in their toothbrush, look at it. I mean, it looks like the bristles are sprayed all over, right? Because they're brushing so hard. I remember my brother doing that, like seeing my brother's toothbrush and being like, that is not normal. Like if it looks like someone with crazy hair is sticking up the end of your toothbrush, first off, you need to replace your toothbrush. Second off, you're brushing way too hard, right? The other thing, and I really want to make sure I show this, I'm going to show you first just with the regular manual toothbrush. Can you see? I'm going to try and get close to the screen. Look at the bristles. That's way different than any toothbrush you may have seen before, but look at the bristles. They are super densely packed, okay? And because they're so densely packed, they're actually able to disrupt that biofilm effectively while still being incredibly soft. Okay, so let's now take a quick look at the Curaprox Hydrosonic Pro. This is the electric toothbrush that Curaprox puts out. The nice thing, it comes with a little carrying case here. Very sleek. I mean, would travel easily, right? And look at how nice and neat it fits inside of the little case. So we have our toothbrush handle, and it comes with 2 toothbrush heads here. It also comes with an in-tuft brush head that you could use as well. So something like this would be great for the distal of the very last tooth, really hard to reach areas around the pontics of, a bridge or around implants or crowns. Something like that is really nice to get around those prosthetics as well. And then I can't get it out, but of course it comes with a charger as well. So I think the thing I really want to hone in on is take a look at those bristles. Again, super densely packed. They're not going to splay as much. Research actually shows about 30% less splaying than your traditional toothbrush. So if you have those patients that are really hard brushers or a family member that you see their toothbrush just kind of, again, looks like the crazy hair, this would be a great option for them. It is designed to be a sensitive toothbrush, very soft, safe on the tooth surfaces, and effective at the same time, right? We don't want it to be so soft that it's not brushing anything off. We don't want it to just be, kind of swaying around or swishing around on the tooth. We still need it to be effective at biofilm removal. So really excited to partner with Curaprox on this episode. And I definitely recommend that you guys give them a follow on socials. I'll put that down in the show notes. And yeah, reach out to them with any questions that you might have about their products. So I hope today that you've learned a little bit more about dental hypersensitivity and how to manage it. This is one thing, again, like I said, you're going to come across with your patients. And I hope you found some value in today's episode. If you have questions, something that you're struggling with or something that you're coming across, let me know. I'm here. That's what I'm here for. So please feel free to reach out to me. Thank you so much for listening. And thank you, Curaprox, for sponsoring this episode. Have an incredible day and best of luck on your journey. Future registered dental hygienist.